Today's topic is on diseases of sheep and goats, small ruminants. If we are doing necropsies on small ruminants, it's usually an individual animal that is submitted for identification of the cause of death or the cause of illness. As such, one should be aware that many of the diseases that we can encounter in the large ruminant in cattle also may occur in the small ruminants, as well as that small ruminants may have their own particular disease entities that deserves knowledge and deserves to be recognized as such. I would like to introduce the first two diseases associated with the central nervous system as being scrapie and swayback. Scrapie is a prion disease that has been described in sheep for many decades ago by Dr. Hatlow, and it is clinically characterized by signs, abnormal signs such as opisthotonus, tremor, ataxia, head tilt, and as such these clinical signs may not necessarily indicate scrapie, but other CNS diseases as well, as one should be aware. A component associated with animals suffering from scrapie is a loss of wool due to constant brushing and rubbing against certain stiff areas such as a wall or fence. Microscopically, the disease reveals itself as a vacuolar degeneration associated with the cytoplasm of neurons, more so than is seen in bovine spongiform encephalopathy, where the vacuolation is more present within the neuropile. It is now possible to identify scrapie sheep entomortemally by performing biopsies from tissues such as tonsils or the conjunctiva and subjecting these biopsies to immunohistochemistry. We have markers that bring the prion out for the microscopic identification. A second CNS disorder is known as swayback. Animals may be born with the disorder or show signs later on, and it is due to a copper deficiency, and it appears that copper and sheep really do not match, as we will see that there is a significant type of disease that is a result of too much copper that affects a lot of sheep. But again, if it's a copper deficiency, it leads to changes in the brain that are characterized by severe cavitation and lysis associated with the white matter substance, mainly leaving somewhat the gray matter substance intact. A low magnification nicely shows the punched out areas associated with a neuropile, and microscopically it is associated with a spongiosis and even chromatolysis of certain neurons, as seen in this particular slide. Again, swayback is associated with copper deficiency. Sheep have their own respiratory system diseases, starting with the upper respiratory tract. The bot, Oestrus ovis, usually is a saprophytic inhabitant of the sinuses and nasal cavities. However, on occasion, if there is a magnitude of the botflies, an inflammatory reaction may extend into the brain, and then typically these animals will show clinical signs of central nervous system disease. An interesting tumor has been described many decades ago in Barbados sheep, but apparently it's also in other breeds of sheep that it occurs. The early descriptions were with Barbados sheep kept in zoos in close confinement, and resulted in the observation that the tumor suggests an agent in that it could be, and it was transmitted to flock mates in that same flock. And lately it has been recognized as some kind of retrovirus that is involved. The disease entity is called transmissible nasal adenocarcinoma, and indeed it is a malignant tumor, even if at the gross level it reveals itself as only a space-occupying lesion. On to lungs. The best known entity of pneumonia is ovine progressive pneumonia, a lentivirus-induced diffuse pneumonia that has acute and or chronic forms. It is characterized by a lung that does not collapse when exposed to air. It feels very firm, and it is present in a diffuse fashion. One can see in this lung nicely rib impression indicating a filling scenario that suggests a obstruction of small airways as well as alveoli. On cut section, the chronic pneumonia almost looks like a tumor. It is mottled, and on palpation will feel very firm. Again, a mottled appearing infiltrate on cut section that then microscopically is matched by two features. One, a dense multifocal formation of lymphocytes, almost forming lymphoid follicles, and a type 2 proliferation at the site of the alveoli to form a very dense cellular infiltrate that matches the gross appearance. Again, it is recognized as a lentivirus. Other agents that are involved in the formation and development of sheep pneumonia may be bacteria such as Pasteurella. It may be a virus on occasion, such as an adenovirus or a syncytial respiratory virus. In younger animals, one has to think of aspiration pneumonia. Certainly, if one sees a locally extensive formation of pneumonia. This was a case of Pasteurella multocida, a very common disorder that is mainly involving lymph nodes but is extending into surrounding parenchyma, is caseous lymphadenitis. We nicely have a markedly enlarged set of tracheobronchial lymph nodes, and if one looks then into the pulmonary parenchyma, one can appreciate nicely satellite abscessations, and typically the abscess on cut section has a nice laminated structure in that it is a process of necrosis, inspisation, acute necrosis, inspisation, just very much like the growth of a tree. Corynebacterium ovis, being responsible for caseous lymphadenitis, is a saprophyte in sandy soils and likes somewhat the tropical, subtropical humidity in the humid environments, and it is picked up usually as a skin lesion that then migrates to regional lymph nodes and seeds out and disseminates into various organs of the body, not necessarily the lung. And here is a multifocal pneumonia suggesting a embolic pathogenesis, and indeed that's what it was. It is a fungal infection, which probably is a pathogen that secondarily takes advantage of an immunosuppression or starvation or immunologically deranged animal. it was recognized as being the result of an Aspergillus infection. Sheep have their own lungworms. There are 3 species. Dictyocolus philoroides, inhabiting the major airways. Protostrongylus rufescens, inhabiting the smaller large airways. And Malarius capillaris, that is depicted here. All of these 3 species have a direct life cycle, and Malarius capillaris larvae as well as adult inhabit the very distal airways, the smallest airways, as well as alveoli. As such, they're very difficult to recognize. Again, it is almost impossible to identify these little small red foci as suggestive of verminous pneumonia until one looks at these sections, at these areas microscopically to identify the parasite. Just like cows, the #1 congenital cardiac malformation in sheep is a ventricular septal defect. This one most likely was a functional one in that there is an interchange of blood due to its size, estimated about 3 centimeters without a scale. And then white muscle disease, a nutritional myodegeneration, just like in ruminants. If it is affecting sheep, it's usually the diaphragm as well as the muscles of the extremities, rather than certain muscle groups that I presented to be involved in nutritional myopathy in cattle. And it's a very typical appearing change in that there is pallor, and one has extreme difficulties to identify the ideal paintbrush-like pallor in muscles. It's usually a patchy pallor. Liver and sheep hardly go together in that a lot of insults to the liver create a lot of problems to individual sheep and combined to a whole flock of sheep. Here is a very fatty liver, and it immediately suggests ketosis, and indeed this liver most likely is from a sheep that at least has had twins or triplets. It's a result of a status of hypoglycemia, whereupon fat is imported to the liver and there's a difficulty to export such fat. So the net result is a severe accumulation of fatty substances within the liver. Such a liver would be very friable and on occasion would be susceptible to fractures leading to a hemoperitoneum. And again, the formation of ketone bodies can be is appreciated and associated with such a lipidosis, and these ketone bodies can be analyzed for in the urine. Facial eczema is a problem, just like in cattle, that is associated with photosensitization and leads to a scabby, ulcerative gangrenous dermatitis if not taken care of, as you can see here. There's really a problem in countries like New Zealand or Australia, and it follows somewhat the same principles as I developed for cows. There are 3, at least in sheep, there are 2 only, I would think, mechanisms. One is the hepatotoxic form of photosensitization, and the other one would be a direct photosensitization due to photosensitizing plants that are consumed, such as buckwheat. I think the most prevalent form in sheep would be the hepatotoxic form. And there are a couple of scenarios that one can encounter. First of all, the liver does indicate features of pathology in that first it's a very swollen liver, and it seems to be a little small liver and on occasion it shows areas of discoloration suggesting necrosis. The mechanism for some of the causes has been well explained based on the findings that certain molds producing certain sensitizing substances. One that is frequently involved is Pithomyces shatarum, a yeast that's forming sporodesmin, and sporodesmin is then inducing the photosensitization. If one looks for evidence of Pithomyces shatarum, one would like to see the spores, and here is a set of spores that one can appreciate, and it typically has been defined as hand grenades, and I think that's a very good term. It cannot be confused with anything else apparently going into the literature. So if you see a hand grenade-like structure, think of Pithomyces shatarum. Another liver disease in sheep is known as black disease. Its analog in cattle would be bacillary hemoglobinuria due to Clostridium hemolyticum. In sheep, it's a Clostridium as well, but it's called Clostridium novyi and follows the same principle. It's a saprophyte of the liver. If the liver obtains a trauma, the saprophytic form becomes a viable form and releases substances that causes necrosis in the liver, but also hemolysis. I do not have a gross picture for what's known as white liver disease, but this is a microscopic picture showing a vacuolation, or even if you want to call it a lipidosis, associated with some biliary epithelium proliferation and maybe a little bit of an inflammation. White liver disease is a result of cobalt deficiency. And then mycotoxins released from certain fungi, this one is heliotropium, does induce changes of necrosis, and depending on the duration and the dose, not all of the liver parenchyma is undergoing necrosis and degeneration. There is enough tissue left to induce something like a attempt of regeneration, which this liver suggests to show there are nodules in certain areas that obtain a different color. I would think on the surface it's probably not readily visible, but the cut section shows some discrete nodules being the result of a nodular regeneration. A really big disease is copper toxicosis, and the sheep has a very low threshold and tolerance towards copper. As a matter of fact, as little as 0.2 nanomoles per kilogram of body weight may induce entities, disease entities or pathology associated with the liver, and clinical signs associated with copper deficiency, mainly being characterized by icterus, severe icterus, due to a severe hemolytic crisis. And here is such a generalized icterus. One cannot miss it, obviously, and it quickly and readily suggests copper toxicosis as cause. Here again, from the same sheep, skinned, it still has a nice yellow appearance. The liver is showing swollen, rounded edges, a pallor, and then the kidneys have a deep burgundy red appearance, and the urine would also have a red color suggesting hemoglobinuria. A couple of different etiologies associated with the liver are abscessations, again, resulting most likely from infection with Corynebacterium ovis, and then certain parasites. Flukes, again, play a role in liver disorders. Hepatica, Fasciola hepatica being one of them. And in Europe, Dicrocilium lanceatum, Dicrocilium dentricum, the lancet worm is another one. This liver shows again nice evidence of a severe enlargement of bile ducts, a pipe stem-like configuration, and a very undulating cobblestone-like surface. Here again, the prominence of the biliary system versus a relative reduction of the liver parenchyma proper. And one can identify the flukes if one carefully dissects the distended bile ducts. And here is again an open gallbladder to show flukes as well as a melanin-like pigmentation. And then the relative small size of the lancet worm that has undergone phylogenetically a very nice pathway to maintain the life cycle of its life cycle, in that the metasecaria that ants are involved in the transmission of metasecaria, and the metasecaria elicit a product that is toxic to the ants, and once the ants are picking up the metasecaria, they die and remain on the very top of the grass to be picked up by sheep. So I think Mother Nature has invented a very nice way of transmission, and a safe way of transmission as well. I think that type of scenario may not be known generally as far as the lancet worm is concerned. The French tapeworm is Trichonosoma actinoides, Physonosoma actinoides. It inhabits the male bile ducts without causing any obstruction. And then intermediate forms of tapeworms, such as Echinococcus granulosa, as well as Sonurus, Taenia sonurus, may involve the liver, or may involve the parenchyma surrounding the liver. Cysticercus taeniocallis is depicted in this slide as an intermediate parasite involving the liver, and Echinococcus granulosus is also known as hydatid disease, and one can nicely see a water bag-like structure, and if one looks very hard, one can apparently, in some instances, appreciate a scolex and proglottis, as you can see here. So once more, two intermediate forms, Cysticercus taeniocallis as well as Echinococcus granulosus, are involved in terms of causing abscessations as well as cystic changes associated with the liver or the parenchyma around the liver. There are liver tumors that have been described mainly at slaughter, and these are typically originating from the epithelium of the biliary tract and known as cholangiocarcinomas. One can appreciate perhaps the revelation that this is an epithelial-derived tumor by the fact that there are umbilications in certain areas of involvement. This tumor may spread to distant organs as well. The alimentary system, some important diseases to remember. One is associated with the oral cavities with the lip, known as ORF, parapox virus, that is also or may affect people. It has to be differentiated from tumors. This is a squamous cell carcinoma. Here again, a very nasty looking flesh-eating type of squamous cell tumor. ORF, contagious eczema, typically causes a proliferative dermatitis with radirax, and if one looks hard, cytoplasmic inclusions, one really has to look hard, and again, it's a zoonotic virus in that when it is jumping over to man, it may cause these blisters as seen in these hands. Blue tongue again, one more time, a orbivirus that is transmitted by culicoides, again affecting the tongue and other tissues as well. Basically has a preference for endothelium of blood vessels. And one of the so-called pathognomonic changes associated with blue tongue is an intimal rupture of major arteries, in particular the pulmonary outflow tract. This is another important disease causing severe anemia, and at the level of clinical pathology, hypoproteinemia. It's Haemonchus contortus, which is a really very bad parasite that's difficult to handle and is affecting a lot of sheep, very difficult to manage, and it is very typically then already showing its presence by the very white color of the visible mucous membrane as seen here in the eye and sclera, but everywhere internally in the body. And again, the presence of hypoproteinemia is reflected by edema in soft tissues, nicely and typically in the subcutis of the jaw, but anywhere and everywhere else as well. This apomasum shows edema associated with the folds. A composite of organs, pallor of the liver, pallor associated with the lung, again a apomyositis and edema, and this is blood collected from the apomasum. And if one looks very hard, one quickly can identify the culprit, the barber pole, Haemonchus contortus. Another very important disease is enterotoxemia associated with Clostridium perfringens type D. It quickly reveals itself by multiple petechiations and ecchymosis affecting the serosal surfaces. And a hallmark is to look for the famous fibrin tag associated with the pericardium. There is another change associated with the non-target organ, and that's the kidney, pulpy kidney disease, has been attached to enterotoxemia. One has to be, however, very careful. Many times the sheep necropsy is not a fresh one, and the kidney quickly enters decomposition. So I think people are shying away more and more from making the diagnosis of enterotoxemia based on the presence of a pulpy kidney. But a second type of hallmark, in addition to the fibrin clot in the heart sac, may be a symmetrical bilateral hemorrhagic malacia associated with the thalamus, internal capsule, and the midbrain, and clinico-pathologically glucosuria. In order to identify the culprit, I think one has to check for toxin, but a rough examination of feces may reveal a plethora and a monopopulation of medium-sized rods. Johne's disease is a chronic wasting disease. It certainly does affect sheep. and it's a big problem in sheep raising countries such as Australia. Unlike in cattle, one has only very little gross evidence of Johne's disease. Here may be the best to show the mucosal thickening. Microscopically, it's no challenge. One can see a granulomatous inflammation and a plethora of clusters of acid-fast organism by special stain. And then certain coccidia may induce a proliferative enteritis, in particular Eimeria arlingi. The Finnish landrace sheep congenitally acquires a kidney disorder known as mesenteric-capillary glomerulonephritis. It has excited a lot of immunologists as being an animal model for an immune-mediated disease, and indeed it is due to a complement deficiency, particularly as far as the C3 fragment is concerned. It does not really create at the gross level a significant change associated with the kidney, other than maybe small dotted structures that one barely can recognize at the cortex, and indeed microscopically it matches markedly enlarged glomeruli. Here is a involvement of the kidney with caseous lymphadenitis, probably starting from regional lymph nodes and then seeding into the kidney as well. RAMs frequently obstruct the lower urinary tract to induce a cystitis and a rupture, to induce a uroperitoneum, and it is due to the obstruction at the very, very tip of the penis, the known as urethral process, which is a very, very, very narrow passage in these animals. Brucellosis can play a significant role in countries where it is difficult to control, and as far as the male is concerned, it, unlike in maybe other species, affects more or less the epididymis, and particularly the tail of the epididymis. Diseases of the mammary gland may be a problem. A mastitis, not quite as severe as in the dairy industry, but nonetheless it may lead to a involvement of multiple use. The one that created the name of blue bag is Staphylococcus aureus that one has to think of. It causes a necrotizing purulent mastitis and changes of blue discoloration, as you can see through the skin here. The severity of the involvement of the udder is seen on the cut section. Severe necrosis, somewhat sharply delineated from uninvolved parenchyma. The other one that one has to think of is Pastorella multocita. So these two organisms may involve a herd in a severe fashion, such that the nutrition of the lambs is not guaranteed due to a change in the milk consistency and characteristics. Sheep has their own warts. Here is a papilloma that was associated with the skin, but you also can see the papillomas forming in the esophagus, and if they assume a certain size, they may be responsible for esophageal obstruction. This is a case of intussusception due to the presence of nodular worms, Esophagostromum columbianum, and again, it may be just anecdotal. The two have been described to go together like hand and gloves, in that some kind of dysperistaltic motion leads to the telescoping of segments of the intestinal tract to cause an obstruction and an intussusception. And then finally, lymphosarcoma on occasion may affect the viscera, such as the lymph nodes and the urinary bladder, very strangely. I think if it is affecting the lymph nodes, it's more associated with the mesenteric lymph nodes than any other ones, and certainly cannot be very well associated with the superficial lymph nodes. Here is an enlarged pituitary in a sheep to suggest a tumor, and indeed on occasions adenomas have been seen. On to goats now. A scabby dermatitis associated with the skin over the nose and the conjunctiva and the lips may suggest ORF as well, and indeed this could be easily a case of contagious eczema, but this is dermatophilosis, which may affect the goat as well, and one also has to think of internal changes associated with the blood vessels, as you can see here in the heart, resulting from bovine malignant catarrhal fever, herpes virus infection. Here again, a scenario of a thickened, scabby skin combined with alopecia in the tropical and subtropical climates easily should suggest infection with dermatophilosis. Listeria, and then a viral disease known as CAV, caprine arthritis, encephalitis virus, lentivirus, develops various changes in various organs depending on the age of the goat. If it's a young kid, it is involving the CNS system mainly to induce changes in the neuropile that are spongiotic, as well as proliferative gliosis, and the loss of myelin calls upon the Gitter cells to clean up the changes. In the adult form, it affects more of the joints, the lung, or the udder. As joint disease, it causes a synovitis, and if one is lucky, one can appreciate joint mouse. This is not the case here in this picture. The virus replicates in macrophages, and the macrophage calls upon lymphocytes, and at the microscopic level, the changes associated with the joint is a synovitis, a lymphocytic, histiocytic synovitis. If it is a lung, if it affects the lung, it's a diffuse pneumonia, just like in progressive bovine pneumonia. And this was the last case that I saw in a goat. It was a 12-year-old goat that was proven to be seropositive for CEA by ELISA, and during its life had bouts of lameness and swelling of joints, but finally developed a respiratory disease. That was a very nice indicator for the presence of persistence of the CA virus, the lentivirus, in that it created the diffuse thickness, uncollapsed type of lung. And notice this little focus here, and at first glimpse suggested the presence of a tumor. It was tissue and was clearly delineated from the rest of the lung by a different color and consistency. It was soft, elastic really, and it turned out surprisingly to be a focus of cryptococcosis. And indeed the association of CA pneumonia, diffuse pneumonia, and cryptococcosis has been established in the literature in a couple of goats. To me, cryptococcosis in goats is certainly something of a novelty, and it fooled me certainly too. I didn't recognize it as such until microscopically this tissue that felt somewhat soft elastic and different from the rest of the texture of the lung was a very spongiotic tissue, and one can nicely see the yeasts and then some peculiar cells that sort of looked like foam cell macrophages. And in other sections there were evidence of mineralized corpuscles, such as seen here. Whether or not these are yeast structures that attracted mineral salts or not remains to be seen. Here's sort of a beginning concretion that is mineralized. And the main picture of his lung was that of a type 2 cell pneumocyte proliferation that obstructed airways, and I do not have it here, in some areas alveolar proteinosis, which according to the literature is very suggestive of pneumonia resulting from lentivirus infection. A different terminology describing the same entity of lentivirus pneumonia is Jagdsichte, or pulmonary adenomatosis. And again, it reveals a lung that almost looks like it conceals a neoplastic proliferation. It is a very knobby, nodular type of tissue resulting from an adenomatoid transformation of type 2 pneumocytes into a fetalization of the lung, again in the earlier literature being described to be associated with Jagdsichte, and in some instances it was also thought that in addition to the lentivirus, a herpes virus might be involved. And there are a couple of case reports in goats where indeed a pulmonary adenomatosis turned apparently into an adenocarcinoma with metastases to the kidney. And again, it remains to be seen whether this is one of the same cause revealing itself in with different morphologic features. Caseous lymphonitis typically again starts as a skin operation to travel to the draining lymph nodes. And here's such a large lymph node. If one opens this lymph node on cut section, the lamination would be the key. And what appears to be looking maybe like a water bag associated with tapes was nothing but a cyst associated with the cranial mediastinum. One has to be very cautious to overinterpret changes associated with the apomasum in goats and not falling into the trap to call a tissue that is white glistening and seems to enlarge and over-accentuate apomasal fold to be lymphosarcoma. That's nothing but fat. Likewise, in the heart, well-nourished goats will sometimes mimic something that may be faultily interpreted as being white muscle disease or myodegeneration. I learned these two lessons by constantly making the mistake to overinterpret and think of diseases that did not exist, and it's just nothing but fat. Johne's disease in goats does exist, and it again is a chronic proliferative disease, here nicely showing a lymphangitis associated with the mesenteric lymphatics. Little nodules and granules associated with the intestinal tract in a goat with diarrhea suggests the presence of Eimeria longii, and on histopathology one can appreciate at various stages of the protozoan. A goat that is well nourished shows changes associated with the liver. that may mimic a tumor but turn out to be an abscess. Again, certain joints, like the carpal joints in goats, suggests the presence of a CAA virus. Typically, the carpal joint itself or the bursa overlying the carpal joint is involved in a synovitis and ultimately arthritis. But a close contender and differential agent should be Mycoplasma mycoides, variety mycoides, that one should think of. Here again, the open joint to show a synovitis and an excess of fluid in CAA. ORF, not only the virus of ORF is not only associated with the oral cavity, but in goats may affect the skin of the udder. Mastitis in goats is perhaps not that much of a problem as in cattle and sheep, but nonetheless, the same organisms that cause blueback in sheep may be involved in the mastitis of goats and or gram-negative organisms. This was a very interesting case, a heavily and markedly enlarged udder weighing about 10 kilograms in a very small goat, obviously caught the attention of the owner, the clinician, and ultimately the pathologist. It really suggested a neoplastic involvement, but it wasn't. It was a very, very chronic fibrous mastitis, really, that in retrospect I think might be the result of a lentivirus infection, CAE. One has to think of that as well. An interesting scenario of twins showing schistosomus reflexus being characterized by a ventral abdominal slit that leads to the evisceration of major internal organs and a deviation of the hind extremities to the dorsal aspects of the body. If the goat is kept as a pet goat and gets older and older, it does indeed develop certain neoplastic growths. The most famous one linked to a certain breed of goats, the Nubian goat, is known as lymphoma, as depicted here, craniate to the heart, phymoma. Just like in the sheep, on occasion, goats do develop an adenocarcinoma, and it may be a transmissible type of adenocarcinoma as well. Lymphosarcoma affecting the nasal passages and the skin, very bizarre location. More typically, internally involving lymph nodes, and these are subaortic lymph nodes, kidney, bone marrow. Another case of a primary cholangiosarcoma metastasizing to intestinal tissue, very bizarre behavior, starting out in the liver. A nephroblastoma obstructing the architecture and enlarging one kidney, metastasizing to the liver. And the mammary gland, so very bizarre behavior again. And then finally, adenomas associated with pituitary may produce prolactin to induce what's caused the milking buck syndrome. That's a very interesting scenario. Notice here, this animal has both an udder that indeed produces milk and the phenotype of being a male, and indeed this was a male, and it had a prolactinoma, a tumor associated with the pituitary gland, to create a functional udder, the milking buck syndrome. Strangely, a mast cell tumor associated with the skin, a set of adrenals to show a pheochromocytoma on both sides, and then finally a tumor associated with the thyroids to induce a adenoma or adenocarcinoma of the thyroids, and that is the end of my presentation. Hello, my name is Claus Buergelt. I'm a professor of veterinary pathology with the Department of Pathobiology at the College of Veterinary Medicine in Gainesville, Florida. I'll be delighted to be here, and I would like to thank the C.L. Davis Foundation as well as the Armed Forces Institute for providing me with the opportunity to demonstrate some cases of zoo animals as they were necropsied in our institutions. I would like to start with elephants. About 15 minutes south of Gainesville is a set of element collection that may be called a senior home for retired elephants. These elephants were circus elephants, and after many years were retired from the circus and are kept in a well-managed area, again not too far away from Gainesville. Unfortunately, it is also a quarantine station for certain elements that were diagnosed to be infected with Mycobacterium tuberculosis. Nonetheless, these animals, these elderly elephants, are kept very well until such time where it is deemed necessary, perhaps, to euthanize them due to probably the number one age-related problem, and that is a chronic osteoarthritis that once the elephant is recumbent may be very, very difficult to handle. I had the opportunity to be involved with about 3 elephant necropsies, and I would like to share the results thereof. The first one was indeed diagnosed to be infected with Mycobacterium tuberculosis without actually showing clinical signs, and the diagnosis was obtained through a trunk wash that apparently is performed in all of these elephants 3 times per year. It is a very elaborate procedure, if one can imagine what kind of volume the animal most likely will pick up for his trunk and return through his trunk, literally a bag full of water, but it's a very successful scenario to culture the Mycobacterium in order to identify the presence. Again, these animals hardly will show clinical signs. It's estimated in the literature that between 2 to 4% of circus elephants are infected with Mycobacterium tuberculosis and really present a concern for public health. So in addition to be retired, there is a constant quarantine, and these animals are constantly surveyed for the presence of mycobacteriosis. This elephant indeed had changes that were very impressive and present in the lung, and here again various areas of caseation necrosis in various portions of the lung. Internal lymph nodes at the site of the arrow revealed a more drier type of abscessation, not really showing a nice caseation necrosis, but nonetheless, microscopically, it was a pyogranuloma, suggesting very typically the presence of a higher structured organism, and certainly in this case, the presence of Mycobacterium. Nice Langhans-type giant cells embedded in small granulomas, dry granulomas, but in major areas, larger areas, caseation necrosis was an additional feature. One had extremely difficult at time, and I'm pretty sure one really has to focus in to see a very lonely, solid individual rod, small rod, that picked up the acid fast stain. Again, is mandatory to identify the mycobacterium by cultural isolation, mainly on Löwenstein agar. This is a set of tubes that is primarily used to identify Mycobacterium avium paratuberculosis, but nonetheless it's a supportive medium for other pathogenic and saprophytic mycobacteria as well. This elephant was about 55 years of age and had, in addition to the presence of the pulmonary form of tuberculosis, evidence of chronic renal disease, as you can see here. Probably not severe enough in order to cause renal failure. A second animal, this is Barca, was about 34 years of age, with a loss of condition in the history and a loss of weight. And indeed, this animal revealed a significant degree of muscle loss and condition loss. It was very emaciated when it was put down. On the necropsy, multiple large nodules and nodes were associated with the entire abdominal cavity. We are looking at the mesentery, as it was the first set of tissue that was removed from the abdominal cavity, to see the degree and the severity of what appears to be a neoplasm, and indeed it was. Other structures associated with the kidney as well as the reproductive tract showed a similar nodular proliferation of tissue that microscopically turned out to be a carcinoma. In specific, it was a carcinoma arising from one of the ovaries. If one deals with an ovarian carcinoma, one probably has to look at the coelomic surface as being the site of origin. This one metastasized by implantation mainly throughout the entire abdominal cavity, but it also interestingly involved mediastinal lymph nodes. And at that time, being an animal that was in a setting where tuberculosis played a role, one certainly had to think of the possibility of a miliary type of tuberculosis as well, but luckily it turned out to be a site of metastasis from this primary ovarian tumor, carcinoma. Older elephants, typically female elephants, typically have leiomyomas in the reproductive tract, which are incidental findings. They are not causing any major problem associated with the well-being of that animal. They're just signifying the presence of an elderly female elephant. And here we have such a very small nodular scenario that sort of bulges through the serosa in the uterus, and this is one of the ovaries for comparative purposes. An ovary, again, characterized just like in the mare by the presence of a very, very dense fibroblastic, fibrovascular stroma embedded within the ovarian germ cell tissue. And again, we are dealing with a fairly elderly elephant. There's probably very little activity of cyclicity going on there. As I indicated, and this is a picture of the third animal that had to be put to sleep because of severe osteoarthritis and osteoporosis. Once an elephant is recumbent, it means somewhat that he or she has extreme difficulty to get back up, and I guess euthanasia might be just the only choice. To appreciate the scenario, we're looking at the articular cartilage of the stifle joint to show a remodeling, so to speak, or at least a loss of the typical bluish articular cartilage surface. Instead, it is replaced by proliferating plaques and areas of ebonation. And if one takes the time, and it indeed takes a long time to go through a complete necropsy of an elephant, to look into these joints, one quickly can appreciate the severity and maybe the reasoning for the solution to put an elephant down. Speaking about an elephant necropsy, it requires its own set of tools, characterized by forklifts, bulldozers, electric chains, and on it goes. And the most difficult segment of the elephant necropsy, in my my experience, is the removal of a brain. That's why this head is here. It takes anatomic knowledge, it takes muscle power, and a lot of electric and manual large equipment, such as a crowbar, in order to crack open the vault. But nonetheless, it can be done, and obviously most of these elephant necropsies are done in the field, and there was no difference as far as this elephant collection in Williston is concerned. We did the necropsies in the field, and it sort of was also a good reasoning under the aspect of TB being prevalent in this herd, to keep things just in a defined enclosure. Another example of a large animal necropsy is a case in a giraffe that was done in the field and brought to my attention. This was an elderly giraffe that clinically suffered from diarrhea, weight loss, and it was examined for various causation, including parasites as well as enteric pathogens, to come up with the culprit, but to no avail. Some clinical parameters suggested anemia that was non-responsive. And again, supportive treatment maintained the life of this giraffe for a significant period of time, until such time where it was felt to put her asleep, because whatever was tried was unsuccessful. And here's the reason why. As an incidental finding, we found some rocks in the apomasum, but that's certainly not the reason why this animal had diarrhea and suffered anemia. It wasn't really an interesting case from a comparative aspect. This is the apomasum, and I have only done a limited number of giraffes, so I wasn't really prepared to immediately recognize the lesion, and the lesion is characterized by a thickening in a diffuse fashion of the apomasal folds. So I suggested that this might be an apomyositis, and since it does look a little bit on a comparative basis like osteitargia infestation, I thought maybe, well, it might be possible that the parasitologic flotation detection system wasn't successful to identify, despite the fact that I was assured that several fecals were done without finding any parasite. And indeed, there was a good reason that it wasn't osteitargiosis, chronic proliferative apomyositis, in that I didn't find any evidence of parasites. Instead, it was very difficult to photograph. The entire mucosa was characterized by a severe, sometimes disorganized proliferation of both chief cell and parietal cells, and interspersed in the lamina propria were cells such as lymphocytes and plasma cells. Here a high power view of the proliferating gastric mucosal cells, and indeed it was then suggesting the diagnosis of proliferative gastritis, and on a comparative basis it mimicked a little bit what's known as Menetriers disease in human beings, being characterized as a proliferative gastropathy with proliferation of mucosal cells, as well as an typical infiltration of lymphocytes and plasma cells. But more importantly, functionally, Menetriers disease leads to B12 deficiency due to the lack of synthesizing intrinsic factor, and that exactly was the case here in this giraffe. In addition to diarrhea and weight loss, the clinical pathologic parameters were that of an anemia. So I thought that was an interesting case to look at and to decipher. At times, it also was felt maybe that Mycobacterium avium paratuberculosis played a role, because in that collection of giraffes, Johne's disease existed. Here's a very small giraffe. Actually, it's a neonate. Actually, it's even not a neonate. It's an aborted fetus, and it had changes associated with the heart and the lung, as well as from its blood we cultured salmonella. So it was a little interesting scenario to, if you want, link salmonella septicemia to abortion. On to rhinos. There are two kinds, the white rhino and the black rhino, and my institution was involved with a necropsy of about 5 rhinos, particularly at the time where the animal kingdom at Disney opened up and stocked their animal species that came from literally around the world, but certainly from many distant sites within the country, many times being transported by truck, and as such suffering, like all other animal species, from the trauma of transport and certain disease entities. And some of them actually never made it to the animal kingdom. They died en route, unfortunately, and were then brought to my institution for a necropsy. Again, I'm sort of trying to mix in aspects of comparative anatomy. I did not know that I learned from a pregnant rhino that the placentation looks very much like that of a horse. It's a diffuse placentation with a very nice chorion allantoic surface showing the presence of microvilli. A black rhino that had a very bizarre scenario in that it had a very severe infection associated with a peritoneal cavity and the thorax due to a foreign body. We could not figure out exactly how that foreign body internalized, but it certainly induced a very, very significant inflammation, and it also penetrated through the diaphragm to induce a pneumonia. A variety of organisms were cultured, but the significant lesion here is the widespread inflammation, as one can appreciate it in the mediastinum surrounding the heart sac. Speaking about black rhinos, in the literature, the number 1 lesion is due to a vasculopathy and is identified as idiopathic hemorrhagic vasculopathy syndrome in black rhinos. There are 1 or 2 nice papers describing this entity. It's undetermined what it is due to, but it's apparently compared with equine purpura hemorrhagica, and if that's the case, it ought to be an immune-mediated disease, and again, it's a vasculitis leading to extravasation and causing severe anemia in these animals. I just learned that one of the black rhinos at Disney World, the United Kingdom, suffered from this entity at post-mortem. Again, to show the dissemination of the inflammation in this particular rhino. Just like elephants, but probably not quite as demanding, heavy equipment is needed for performing a necropsy in a rhino, starting with a tractor trailer forklift type of thing, and the same crowbar as well as electric saw is needed to access various cavities, including the brain. This was an animal, a white rhino, that also became diseased by being transported over a long distance. It reached its destination. However, it never really recovered from the stress and died ultimately, and came for a necropsy to Gainesville, and also had evidence of a severe pneumonia that comparatively looked very much like shipping fever. We did not culture a significant pathogen out of the lung other than E. coli, maybe due to the fact that it wasn't quite a fresh necropsy anymore, and it might have been just an overgrowth. And the reason why that wasn't a fresh necropsy quickly becomes evident by the severe gaseous distension of the stomach, compressing basically against the lung, but the lung surface shows evidence of a pruritus, fibrinous and fibrous at the same time, and on cut section revealed a very severe, at least hemorrhagic event, but it was more than hemorrhage, it was necrosis, severe necrosis combined with acute inflammation being present in the airways. So it was a bronchitis, bronchopneumonia, hemorrhagic event that looked pretty much like a shipping fever, and evidence of stress was seen in the GI tract, in the small intestine, the interior small intestine, little ulcerations. An incidental finding was a scenario of fat necrosis being associated with the abdomen. A third rhino had diarrhea as well as loss of condition, including weight, and showed changes associated with a small intestine that sort of created a thinning, overall thinning, but relative accentuation of the mucosal surface with some kind of fibrinonecrotic exudate on the surface, suggesting perhaps salmonellosis. It was not actually, we could not identify any enteric pathogen in this animal. Microscopically, I think the changes were associated with the villi that were very clubbed, widened, and shortened, and a moderate infiltration by lymphocytes and plasmacytes suggested perhaps something like a sprue lesion, a malassimilation, malabsorption syndrome. Again, it's speculative to go that route as far as comparison is concerned, but in the absence of any significant pathogen, that might be a thought, since luckily rhinos, being an extinct species, are kept, when in captivity, with the best of the management. data that indicate maybe a pattern of such a intestinal disease in rhinos are very difficult to obtain, and it might be just an isolated case as well. The jury is still out. An unfortunate case of postnatal loss of a rhino baby was a result of Isoerythrolytis neonatarum due to a multiple breeding of the same parents, and that is very similar a condition that is seen in young foals. And indeed, this animal had a markedly enlarged spleen and severe icterus. On to hippos. This was also a very sad case in that hippo was meant to be stocking the present colony at the Animal Kingdom in Disney, and was transported by trailer truck over a long distance and fell sick while being transported and became recumbent and was actually euthanized and then necropsied. The necropsy revealed a change that was visible via good external examination and was associated with a mammary gland. And indeed, it turned out to be a mastitis, a necrotizing mastitis. We culture staphylococcus from it, but it looks more like a gram-negative mastitis. But that wasn't the reason, the imminent reason, but it certainly could have sickened the animal, why the animal became recumbent. Just a photomicrograph of the presence of multiple organisms that stained gram-positively and a hemorrhagic necrotizing mastitis. The reason why it became recumbent was associated with a skeletal musculature, severe pallor in various segments of the musculature, with myolysis and loss of striation, but very subtle. More importantly, the kidneys were dark red and the urine was dark red, suggesting capture myopathy. And indeed, that was very similar to capture myopathy. Best illustrated by finding sediments, erythrocyte sediments in the renal tubules. A nice case in a camel, and typical of an organism that is present in the southeast and just likes humidity and moisture. And I'm talking about a fungus-like organism, an oomycete, that I'll bring up again when we're discussing dogs and cats, known as Pythium. This camel lost weight, wasn't eating well, and had already on ultrasound evidence of dense areas associated with the stomach, and indeed these dense, and the anterior small intestinal tract, these areas were characterized by a necrotizing proliferative tissue penetrating through the mucosa and also into the wall, microscopically purulent and granulomatous. You may call it pyogranulomatous. And on larger magnification in the center were, with the H&E stain, ghost-like hyphal structures that with special stains. Stained positive with silver and was mildly branching, on occasion segmented. And this morphology, in conjunction with the measurement, suggested very much Pythium insidiosum, and indeed that was the cultural isolation again. Pythiosis is a soil oomycete that mainly causes skin infection in animals such as horses and dogs, but the elementary form is known very much in the dog as well, and this I think is a very nice, comparatively spoken again, case of elementary piphiosis in a different species, in this instance a camelid. On to tigers. Just like in elephants, there is a retirement home for tigers in Florida. These are typically circus tigers that, when retired, are given the benefit for their appearance as a working animal, if you want, until such time they either have to be put down or die naturally. We do then see these tigers for a necropsy, and over the years we probably did about 10. All of these are older tigers that, as a common denominator, seem to have one specific disease that I'll bring out later on. But individually, certain specific organ systems were involved in disease processes that I would like to share with you. The first one, whatever the problem was prepared for anesthesia, for surgery, but didn't make it through anesthesia. So that was a tragic event, death through anesthesia, where usually you don't find anything other than that you have a history that there was a problem with anesthesia. The second one lost weight because he refused to eat even the best of the meat, and the reason why he refused to eat can be seen associated with the oral cavity. Some fungating growths that did at first glimpse, to us at least, suggest the presence of a tumor, but it wasn't. It was a very severe granulomatous stomatitis and glossitis, and unfortunately we were not able to identify an agent. Another Bengal tiger, adult, elderly, had a interesting tumor associated with a kidney that was diagnosed as myxosarcoma, and actually indeed metastasized. We thought the primary site was the kidney, but one never is sure because there was also lung involvement. So take your pick, it may go either way, other than that it was a apparently malignant tumor that, as far as the kidney is concerned, replaced larger areas of the parenchyma. And here is the focus of metastasis in the lung, not really exactly mirror imaging the picture of a tumor in the kidney, but nonetheless the production of mucin is obvious. Another tiger had problems with the locomotor system, and that is probably something, at least out of the 10 tigers that we necropsied, 3 of them showed a discospondylitis and a malacia associated with the overriding spinal cord, in conjunction with chronic arthritis of major joints, creates a tiger that probably wobbles. And I went to the zoo on Sunday here, and I saw the female tiger marching up and down and around the water, but I think she showed some weakness, as far as I'm concerned, in her hind legs. And I sort of had the mental picture that this might be the result of a discospondylitis or degenerative disc disease, or perhaps a disease associated with the joints of the hind legs. I'm not sure, but I sort of have the vision. I don't know how old this animal is, but it looked like an elderly tiger to me, that it might suffer from this condition, which I think may be a problem associated with older tigers. And here, better viewed as a microscopic demonstration of a disarrangement of articular cartilage as well as osteoid, trabecular, woven bone with some kind of inflammation. Yeah, here is the femur of the same animal to show ebonation. Not quite as dramatic as you may think. It should be in relation to the clinical picture of hind leg paresis. We did the necropsy on 2 white tigers, which were kept in different institutions. This was a representation of a private collection, and this was a man-eater and had to be put to sleep. And I guess the sheriff's office required a necropsy. We didn't find anything. The second one came from a different collection, and it had a very nice disease that had not been described hence in larger filletes, and that was cytoxozoonosis. Not very visible at the gross level, excuse me, but more so microscopically due to the presence of organisms associated with the endothelium, macrophages, occluding in the lung here, vessels, and disseminated all over the place, particularly as far as major organs are concerned. Here, a blood vessel showing various formations of cytoxone in the endothelial cell. Zoos try to prevent female tigers to come into heat by installing progesterone-like substances, and if it is suspected that it may be associated, if that is done over a lengthy period of time, with diseases seen in the uterus that are indeed primary tumors originating from the endometrium. I have collected a couple of these cases that at the gross level from the outside reveal little indentations here on the surface, and are more impressive as far as the extension on cut section is concerned, that the tumor cells, neoplastic cells, seem to extend over the entire body and the horns of the uterus. And if one looks at those microscopically, they are adenocarcinoma. Whether or not the association with these hormonal depositions in the skin of these tigers is true or not, I think the jury is still out. Pneumonias can be quite severe, and here is a tiger that has, in addition to pneumonia, some proliferations associated with the oral cavity that might have been the result, and almost looked like an inhalation pneumonia. We didn't culture a significant pathogen from it, but the pneumonia was severe enough. Just like domestic cats, all the tigers reveal incidental findings such as cystic structures in the liver originating from the biliary tract. And again, this tiger had evidence of disc disease and degeneration at the disc space, and showed signs of lameness. A set of white tigers right after birth was neglected by their mother and had to be hand-fed and developed problems in terms of the esophagitis. They could not swallow the milk, they could not suckle from the bottle, and were given some tubes, were fed by tubes, placed into the stomach, and didn't make it quite. And both of them had a severe hemorrhagic enteritis that did not reveal any evidence for a pathogen. and suggested a shock-like gut, and that actually was a final diagnosis. On to lions. We were involved in a very interesting scenario whereupon lion cubs at the age of 3 months were presented with evidence of a head tilt, incoordination, and at very, very close examination, a very, very mild doming of the skull. This was the external appearance of such an animal. Again, it was more impressive seeing it alive to show these signs of incoordination, basically suggesting some kind of problem with the cerebellum. And indeed, that's what it was. It's a combination between a malformation associated with the cranial vault and a herniation of the cerebellum known as Arnold-Chiari syndrome. This situation was examined closer, and again in the literature was described in England mainly, and it was, right or not, associated with hypovitaminase A on a comparative basis, what has been known in calves and in men. So I would like to quickly then show you some of the aspects of the disease. When removing the brain, it didn't really show the flattening of the cerebellum and the coning of the cerebellum very nicely, but before this articulation of the head, one clearly could see aspects of a cerebellar vermix at the site of the atlanto-occipital joint. In some of them was a mild dilatation of the lateral ventricles to suggest the presence of hydrocephalus. But impressively was this bone plate at the site of the tentorium cerebelli that was extremely thickened and then pushed the cerebellum through the atlanto-occipital joint such that it really created a cerebellar herniation. There are about 2 or 3 reports in the literature to suggest this syndrome. I think it probably has a congenital component to it. We never really were able to identify the parents of these cubs, but it again has been described in other zoological institutions as well. Here one more time, the thickening and density of the bony plates at the site of the tentorium cerebelli. A case of pneumonia in an adult lion was quite severe. Here's another one. Again, a convincing pathogen was not identified other than the severity explaining the clinical signs and maybe also the death of the animal. A plethora of organisms and a lake of neutrophils representation. A case of what appears at first glimpse to be a multifocal hepatitis was not a hepatitis. It was a seeding of neoplastic epithelial cells that originated from a mammary tumor. I do not have a picture of a mammary gland, but it behaved just as in our domestic cats in that it widely metastasized, including the liver and the lung. And here is such a configuration of papillary and adenomatous tubular structures. Again, we did see one of the mammary chains to be enlarged and to have the same neoplastic proliferation to make the diagnosis of a metastasizing adenocarcinoma originating in the mammary gland. And just like in older tigers, older lions, particularly the male ones, the combination of being lazy and being overfed resulted in what appears to be very compatible with the diagnosis of OCD, or at least one can identify this change as crack in the articular cartilage as degenerative joint disease. On to different phthalates. Here's a sorrel cat that showed evidence of a pancreatitis, and it probably was more severe than depicted in this picture. Many of the cats that we did necropsied had evidence of pancreatitis as well. Some of the examples will come very soon. A snow leopard had a distended abdomen, being the result of a gaseous and watery catarrhal-like accumulation in the small intestinal tract that was culture positive for salmonella. We had a problem with the owner in that the owner wanted to have back the skin, and it was a battle somewhat to convince the owner of the public health aspect that it most likely would not be a good idea to go home with the skin. Jaguars, a gastritis and enteritis of undetermined etiology led to aspiration pneumonia. It looks very much, and we thought maybe, and we certainly did think of the presence of Helicobacter-like spirals here, and indeed it sort of was somewhat showing a lymphocytic plasmacellular gastritis in addition to the extravasation of red blood cells. It didn't hold quite up, however, the degree and the severity of the hemorrhagic gastroenteritis was quite impressive. And here the necrotizing changes in the lung and the gross aspect thereof. Frequently in earlier years, felids in zoos developed hepatic cirrhosis. Here is a case in a jaguar that I saw many years ago, and it is felt that it might be a nutritional deficit of an important amino acid, choline. Choline deficiency has been described in lab animals to induce cirrhosis, hepatic cirrhosis. I have not seen it subsequently, so maybe if that was true, supplementation of the diet might prevent such a cirrhosis. A case of multiple nodules in the liver in a jaguar turned out to be the result of nocardia, and again the same animal had evidence of a pancreatitis. It seems to be in these types of cats something that at least causes a health problem, if not demise, the pancreas being frequently involved in a very fulminant acute inflammation inducing fat necrosis or whatever you can see in a subsequent secondary to a pancreatitis. An African jaguar had evidence of chronic renal disease and clinical signs of chronic renal failure. To show the glomerular changes and the fibrotic changes associated with the interstitium, one may want to look for oxalate crystals, but we were not successful to see them. Oxalate, not necessarily from ethylene glycol intoxication, may occlude originally the tubular apparatus and induce a slow progressive renal disease that leads ultimately to renal failure. Just as many of the older cats, the liver showed evidence of biliary cysts. A cougar had severe inflammation associated with the pancreas, again to induce a pancreatitis. The liver did not look very healthy either. Another one that we had from a different collection that came actually from the wild had evidence of coccidiomycosis, just to citate two diseases that I saw in cougars. On to cheetahs. We know it is a breed of fillets that suffers from a lack of genetic diversity, and as such is more perhaps and most susceptible to certain disease entities. And there are a few in the literature that if one has a cougar one should think of. One is the gastritis due to Helicobacter-like organisms causing a gastritis, gastroenteritis, being characterized by a lymphohistiocytic infiltrate. Another one is veno-occlusive disease. A third one is glomerulosclerosis. And a fourth one is systemic amyloidosis. I only can present evidence of a case of gastritis causing a hypertrophic gastropathy and being positive for the presence of Helicobacter-like spiral organism and inducing a severe proliferation of the gastric mucosa. A second one had a very nice leukodystrophy associated with the brain that didn't reveal itself at the gross level, but microscopically was characterized by a state of spongiosis and a lack of myelin demonstrated by special staining, something that has entered the literature and is very much a maybe fifth disease that one can encounter in cheetahs. This cheetah came from a private collection as well. On to camelids. I have one case of a arthritis due to Cryptococcus neoformans. Very nice case to show a distortion of a joint with synovial proliferation and the presence of the yeast among and intermingled by an inflammatory infiltrate and very reactive lymph nodes that also contained evidence of Cryptococcus, as you can see here. A second one had lumpy jaw, Actinobacillus bovis, and the third one had coccidiomycosis affecting the lung and the lymph nodes. So again, these are disease entities that are very sporadic, are not a challenge really for a pathologist at the microscopic level. If one sees the typical configuration and inflammatory response that one expects resulting from the presence of the agents, but more importantly, if one can identify the agent. And here is the endosporulation of coccidiomycosis. Kangaroos belong to Australia, and I think our Australian colleagues are much more knowledgeable about the pathology of kangaroos. On occasion, they're kept as pets and die, and one of these died of coccidial enteritis. Another one died of a nephrolithiasis leading to obstructive renal disease, resulting in renal and post-renal nephrosis and uremia. An interesting case of binturongs that are very susceptible to infection with the virus of canine distemper. They need to be vaccinated over and over and over, and if that's not the case, they're very, very susceptible, and indeed 2 or 3 animals from this collection had evidence of distemper infection being characterized by a pneumonia with inclusions, if one was looking heavily for heart pad disease, as well as inclusion. I would like to continue with a slew that was sick. One really has to be an expert on these animals to differentiate a healthy slew from a sick slew. I think the difference may be very minor, but nonetheless this animal died, and after a necropsy revealed not so much of, not any really clue at the gross level, but microscopically became evident that toxoplasmosis was a diagnosis, and it was a very nice disseminating case of toxoplasmosis. So somewhere along, if it holds for a slew, it might be a secondary opportunistic type of infection due to an underlying primary cause. Again, being a slow animal, naturally it's probably very difficult to determine what underlying cause that might have been. We did a couple of primates. This is Willie, and Willie was a 21-year-old lowland gorilla that was kept in a private collection. I was told it was a very docile and well-behaving animals until such time he became sick, he became unruly. Despite of the change in the behavior, he was examined and found to suffer from heart disease, and indeed he had evidence of changes associated with myocardium that at the gross level can be best described to be pallor and suggest maybe evidence of fibrous tissue that was verified at the microscopic level, where various acute or chronic changes of what might have been a myocarditis revealed themselves to be quite compatible with a clinical diagnosis of heart failure. Being in Florida and being raised in Florida, one of the causes that one has to think of is the virus of encephalomyocarditis, that indeed affects collections in zoos, such as apes, elephants, and also can involve human beings. An orangutan suffered respiratory changes due to smoke inhalation from a fire close by, and shows that there is various degrees, in addition to autolysis, of sloughing of epithelium and inflammation, and very severe edema and separation and distension of the interstitial spaces due to very congested capillaries. A case of pancreatitis in a baboon caused severe peritonitis due to the release of pancreatic enzymes and the proteolytic nature of these enzymes. So the surrounding tissues were very necrotic, and it probably was a case of septicemia, toxicemia. The degree of inflammation and secondary changes as far as fat necrosis is concerned is depicted in this photomicrograph. And I'm going to present a couple of entities associated with baboons, rhesus monkey, spider monkeys, lemurs, and whatever you have. Here's a case of an intestinal distension by gas and necrosis of the small intestinal tract, something that may suggest salmonella, entamoeba, histolytica, shigellosis, campylobacter. If you're lucky, you are able to identify either one by cultural isolation or by demonstration in the tissue. A case of shigellosis shows a nice cobblestone appearance of a mucosa, and at the microscopic level is coagulative necrosis associated with a very superficial anterocytes of the colon. So this is a necrotizing, fibrino-necrotizing colitis due to Shigella flexneri, most likely. Abscessions in the liver of a monkey were a result of pseudotuberculosis, causing an enlargement and thickening of the edges and maybe a splenitis. Here's a case of a pneumonia in most likely aspiration or anything else in a monkey, affecting both lung lobes. A case of chronic enteritis again. I believe this was the result of salmonella. A case of a necrotizing hemorrhagic enteritis affecting the liver and being mainly due to a severe venous congestion and extravasation. Again, one may want to think of various organisms involved. A vegetative valvulitis and mural thrombosis in the heart of a monkey. And then, on a comparative basis, what might look at first glimpse to be lissencephaly is quite normal in tamarine monkeys. So I just want to show you a variation of the normal presentation of the surface of the brain. And a case of monkeypox I just threw in due to the recent events that precipitated from the transmission of that virus from imported animals out of Africa into prairie hounds and back not so much to monkeys, but unfortunately to human beings. It made the press, but it seems to have slowed down, perhaps due to good management practices. A couple of examples affecting hoofstock. Gazelle here, showing severe emaciation and a watery type of fluid filling up major cavities. In addition to anemia, was diagnosed to suffer from Haemonchus contortus, and one can see the actually nice rounded barber pole-like configuration without the coloration of the barber pole in this photomicrograph. White muscle disease, certainly very impressively infecting the diaphragm, and this is probably a good example of a paintbrush-like streaking of myodegeneration as it sort of follows the course of the myofibers. Bears, a polar bear had severe renal atrophy or hypoplasia. I think it probably was more atrophy than hypoplasia, suffering from renal disease. There's a collection of bats very close to Gainesville in a foundation that is holding very valuable type of bats being imported from mainly Asia, and they're difficult to maintain because first of all in a different environment, and then perhaps due to a lack of well-trained keepers, and subsequently some of them die, and I guess a official necropsy for various reasons is acquired, and a certain definitive protocol of cause and death and necropsy findings needs to be established. So subsequently I was involved in doing some necropsy of some of these bats, being mainly flying squirrels, and they had some interesting pathologic entities. One that shows a prolapse of small intestinal loops resulting from a volvulus. Another one had a disease associated with the liver. And quite a few had changes associated with the heart and developed heart failure and a failing heart causing death. It was again very suggestive of vitamin E selenium deficiency and nutritional myopathy, and indeed analyzing the values, the serum values and the tissue values and the feed, it was detected that these animals first of all required more selenium, vitamin E, and just didn't have the average level as far as their food was concerned. A demonstration of a more chronic scarring focus of fibrosis in the myocardium. Here's one again with a liver problem, a very small and fractured liver. On to birds, all kind of exotic birds are kept in zoos, private collections, and many of those diseased or dead are shipped to Gainesville for a necropsy, because in some instances these are very valuable collections. I'm just going to show you some changes that we picked up. Here's a parrot with a cataract. Here's another parrot with a tissue that was closely associated with the liver, but turned out to be a cystic adenocarcinoma originating from the ovary. Macaque wasting syndrome is characterized by an infection of the proventriculus and the ventriculus, and microscopically by the presence of lymphocytes surrounding the mesenteric, the plexus, the nervous plexus within the intramural cavity, such as the Meissner's or Auerbach's plexus. It's felt to be perhaps the result of a retrovirus infection. Here's an animal with a tumor associated in the abdominal cavity. Might have been very well, again, an ovarian carcinoma, but it was not. It was a case of avian tuberculosis spreading very, very severely through the spleen and the liver. And again, a microscopic specially stained section through any of these tissues revealed the magnitude of the presence of acid-fast rods. Beak and feather syndrome in the older birds distorts the beak so that these animals have a difficulty to pick up food. But more importantly, in the fledglings, causes a severe alopecia, and it is nicely to be diagnosed by the presence of very visible, I should say, amphiphilic or basophilic inclusions that one really can already pick up at low magnification, best seen within the epithelium of the feather follicles, but also if one investigates the beak. In the differential diagnosis of changes associated with the oral cavity and the beak, in older parrots, occasionally a tumor may be involved, squamous cell carcinoma, and one can actually see the extension of the neoplastic growth at the cut section here as well. An interesting case of parrot adenovirus infection also reveals itself by the presence of these multiple large, really impressive inclusions in the liver. This case was also determined to be positive for parrot adenovirus infection via in situ hybridization. Diseases associated with the esophagus may be the result of impaction or infectious agents. Here's a case of an enteritis, severe enteritis. We were unable to determine the cause. Ascarids in a parrot may lead to obstruction and even perforation of intestinal tissue. And then quite often the visceral form of gout already can be envisioned and depicted at the gross level by seeing the severely enlarged kidneys and the many multiple confluent white foci associated with the urate crystals. And we should not forget about the presence of West Nile in zoo collections, private collections as well, just to remind me and everybody else that certain animals are dead-hand hosts and certain birds are the definitive hosts, and it was very nicely to see how quickly The disease spread from north to south and now from east to west. And just like everywhere else, the awareness of monitoring the spread of West Nile has been intensified at the state level, in that it is suggested and recommended to submit dead crows or birds that are found on the street to certain labs, and Florida is no different. We have subsequently seen the West Nile virus also to involve certain zoo collections, but I think the mortality is well under control in these collections. But I just want to remind everybody that this is a new disease that spread quite intensively throughout the nation. Here, preparation to demonstrate the West Nile virus antigen in neurons via immunohistochemistry. On to retites. For a while in Florida, we obtained a lot of dead ostriches for a necropsy due to the fact that it seemed to be a lucrative business. Various entities sprung up in the state that bought eggs or hatchlings or chicken with the hope to raise them to successfully sell as meat or for leather production. And the problem was not so much finding the right environment. I think that was quite compatible with the traditional ostrich raising states, particularly as far as South Africa is concerned. But more so, the lack of management led to the lack of recognizing certain disease entities. So we ended up with requests to do and perform necropsies on ostriches without actually having the knowledge foundation. So we basically learned on the job. And I would like to share a couple of these disease entities with you. Here is one of these poor critters that died or was put asleep, to show a very common, if not when not properly kept, disease associated with the proventriculus impaction due to a lack of peristalsis, due to a lack actually of little stones that are needed in order to synchronize the peristaltic movement of the proventriculus and the gizzard. If that's not the case, the animal eats, picks up the food, but cannot transport it into the small intestinal tract. It ultimately may lead to a rupture and a peritonitis. But impaction, due to a lack of providing pebbles to the growing chick, was one of the causes that led to the demise of many of these ostriches. Here, for comparison, to show you what actually is needed, a couple of stones in order to successfully transport and digest the feedstuff. A prolapsed cloaca was a result of a peritonitis, severe peritonitis due to egg retention. Here is the set of ovary with various follicles, developing follicles, and here is a retained egg, a very impressive large structure that had the size almost of a small basketball, and revealed itself as being an egg that was unable to be passed through the uterus. A case of ursiculitis was probably the result of an insufficient ventilation. Just like in other birds, it was a result of Aspergillus infection, and on occasion we saw a ruptured aorta leading to either a cardiac tamponade, depending on the closeness to the heart, or to a hemorrhagic event into the coelomic cavity. It is very suspicious of maybe copper deficiency, but we never really figured out what it was due to. Leg malformations at the level of the toe or the hock joints led to lameness of these animals. They were reluctant to move, and they were reluctant to pick up food and sort of slowly emaciated. Another species of ratite is the emu. For a while, they were also popular animals to raise. Here was a very nice case of avian mycobacteriosis, very impressively involving multiple organs, as seen best here in the liver. The degree of dissemination is very severe. On cut section, a caseating, necrotizing abscessation became evident, but it spread also into the intestinal and through the intestinal tract. Various segments of the small intestinal tract showed these nodules that microscopically were defined as a pyogranulomatous inflammation with the presence of epithelioid macrophages and multinucleated inflammatory giant cells. And unlike perhaps in the bird that I showed you, the distribution and the magnitude of the presence of acid-fat organisms was rather disappointing and mild. But nonetheless, the arrangement of the acid-fat organism into clusters suggested, and then the cultural isolation identification, this acid-fast organism to be Mycobacterium avium. Another emu, and subsequently one or two more, showed a severe hemorrhagic enteritis with a distension of the intestinal wall and a transmural inflammation to induce a fibrinous serositis. Was not readily recognized as far as the etiology is concerned. We just diagnosed it as a severe hemorrhagic enterocolitis. But subsequently, reports from other states in the southeast suggested this to be the cause, this to be the case of triple E and alpha equine encephalitis virus infection that typically infected emus or rheas and revealed itself, unlike in the horse, to be an intestinal form, and serology and viral isolation verified ultimately this to be the etiology. There are a couple of publications out to demonstrate then the susceptibility of these types of ratites to the triple E virus, and then subsequently succumb and develop a very severe fatal enterocolitis. The spleen also showed areas of necrosis and fibrin deposition, so splenitis was an additional feature of this particular disease. And again, all kinds of mismanaged feed. The wrong composition of feed led to multiple disease entities. One that stood out resulted in renal failure and was traced back to moldy feed, and mycotoxins being the cause. It just behaved biologically as well as pathologically similar to what we know as far as mycotoxin toxicosis in ruminants or horses are concerned, and the characteristic change of a hepatitis being megalocytosis as well as biliary hyperplasia. So this was a case of mycotoxicosis affecting an emu or rhea. Rheas had, just like I presented with the ostriches, in some instances evidence of a rupture and fracture of a major vessel. As you can see here, the aorta with a fatal outcome due to a very severe hemorrhaging into the solemic cavity, or if it was close enough to the heart, causing a cardiac tamponade. Here again, the washed and cleaned area of the site of fracture associated with the wall of the aorta. I'm at the end of my presentation.